Is there a reason why we don't see IVs in the lower extremities? Yes, because we are worried about DVTs and infections. What does that mean? Usually, or the traditional way of inserting things, we have been putting it in the inguinal crease, the groin. Now, in that area, there's high flexion and range of motion, so it's going to disrupt the dressings. Not only that, there's a lot of stool and urine going into that area, and so it's going to infect that site a little bit more easily. This is why for femlines, we tend to take them out after 24 to 48 hours. Now, another problem is DVTs or SVTs, superior vein thrombosis. So, because of Bernoulli effect, the flow rate of the blood is slower and not as fast compared to our upper extremities. There's a lot of pooling there because of gravity, because of Bernoulli effect and pressure. Now, yes, there are feet veins. However, the same reason why I don't like those is the same reason why I don't like the ones in the hands. It is a low flow rate, low hemodilution. There's going to be more complications, and we're going to end up poking them anyways. I don't like to repoke. I like my IVs to one and done and never need another IV until the end of treatment. I digress. We're going to table the feet and hands for a little bit here. Now, with updated technology and technique like ultrasound guided insertions, we can safely find that greater saphenous, that femoral, throughout the entire leg and tap them further away from that inguinal crease towards the mid-thigh. Matt Ostroff in Jersey has been pioneering these mid-thigh insertions, and they have been a game changer. Look it up, Matt Ostroff, Matthew Ostroff. Even has a really good book about troubleshooting different techniques and difficult insertions. Definitely get that if you're at a higher level inserter. Now, of course, with the ultrasound technique, we can pretty much tap anything, but the question is, should we? So as we advanced our skills and insertion practice, we must recognize that the more advanced we do things, the more pre-assessment, the more time taken for critical thinking before we make that decision, because the consequences are different, and we must remember and consider those. Risk to benefit analysis every time. But yes, the lower extremities can be a very good and viable alternative for IV cannulation.